So, welcome to tonight's presentation. My name is Amanda. I am one of the managing registered dietitians here at Functional Nutrition RX. Today, we will be going through menopause and functional nutrition. This is a recorded presentation just to give everybody a heads up. So, after tonight's presentation, I'm going to try to stick to our 1 hour timeline to be done by 7. In case anybody does have to jump off, or they want to refer to something I said in the presentation at a later date, or just give it a listen, another time over. This will be converted to a YouTube video and sent out with the slides within 24 hours of the cessation of today's presentation. So we will be going over what is menopause, the hormone changes involved in going through menopause from peri to postmenopause, weight management, stress management, sleep interventions, maintaining and building muscle throughout this process, and of course we'll wrap with supplementation. Yes, I have a cut on my nose. I metaphorically and physically hit the wall. I'm a swimmer, so I missed my flip turn in the pool. So we're healing. We're healing. We're okay. So just to call out the elephant in the room. So what is menopause, right? It is the biological phase where we end or we reach a cessation in menstruation, where we no longer get our period. We reach menopause once we've completed 12 consecutive months without our period. And it is a time period when we're going through perimenopause to postmenopause, where we start to produce less hormones like estrogen and progesterone. We're going to go more in depth on what this means. Our ovaries cease to be the primary estrogen producing site and no longer release eggs, and our adrenals actually take over as our primary estrogen producing site. So, overview of stages of menopause that I'm going to go into in the next few slides is the three main stages is perimenopause, menopause, and postmenopause. So everybody's an individual. Some may be going through menopause earlier or later than others. This is highly individualized. A great predictor of when you will go through menopause or what you may experience is by, communicating and touching base with elders, if we have that privilege, our aunts, our grandmothers, to see what they had gone through or when they had gone through. So perimenopause is broken into two stages, early and late transition, or A and B. It can begin in early to mid 40s and can last about 2 to 8 years. There's I can never say this word, subtle menstrual changes. So often you might find your period starting to become more frequently. It's not your classic 28 days. It might be shorter in length. And then as you're entering the second stage of perimenopause, it starts to spread out, and you might find that you have missed periods. I've even had a patient, unfortunately, go 11 months without her period, and then just as she's about to enter the full 12 months, she gets her period again. Everyone's a little different. Hormones are going to fluctuate often throughout this cycle. This is often when you experience more irregular periods, the sleep changes. That is one of the most common complaints of those going through menopause is irregular sleep patterns, difficulty sleeping, often in conjunction with hot flashes and mood swings due to the fluctuations with estrogen and progesterone, the balance between the two. So late perimenopause, like I said, is those longer gaps, 60 plus days between periods. That's when you're entering more of the second phase. So early transition is often around age 47, but everyone can be a little different. Late transition or amenorrhea, the cessation of one's period, typically around ages 49 to 52. The average age of onset of menopause is 50. Labs to help indicate if we are going through this transition is our FSH, our follicular stimulating hormone. When you start to see that rise, it's going to rise continuously throughout our life, so from this transition. So FSH greater than 25 can indicate this change. We also like to measure estradiol here at Functional Nutrition RX. So if you do meet one-on-one with a registered dietitian and you are interested in having your labs tested with us or interpreted, maybe your OBGYN ran these labs or your primary care physician, we like to look at your estradiol and help to measure that over time, as your estradiol is indicative of the estrogen that your ovaries are producing. And as that estradiol deduces, and everyone's different with how much they have starting too. Some people may have had more estrogen throughout their lives than other people too. But eventually that estradiol starts to deduce and you start to find the person producing more of their estrogen or in general estrogen coming more from the adrenals as estradiol deduces. It can fluctuate, however. It's important as you're going through this transition to try to monitor or journal or document your periods. So if you want to note the length of your cycles to see if maybe you're in phase one or phase two of perimenopause, the day one of your cycle is that first onset of bleeding. And then you would, measure those consecutive days until you get your period again to note the length of your cycle. Also noting, are they shorter? Are they heavier? Did it not come, but you got other symptoms, breast tenderness? Are there fluctuate if you have fibroids or cysts? Are they changing in size? It's always good to check in with your OBGYN to monitor these. Of course, tracking your cycle, there's different apps that can help. Flow is very common. I also really do like the Aura Ring. It also helps to measure your basal body temperature in the morning, which can be indicative of other things like ovulation to note if you might not be ovulating anymore. It also measures your sleep, your stress, your resilience scoring, your activity. Although pricier than some other options, the Aura Ring is a good all-encompassing fitness tool, and I mention it just because Black Friday is coming up and they tend to do a deal. I like it myself for keeping in tune with my body. There's plenty of other apps, or even Apple Health will let you track your cycle for free, however. So menopause, right? It's defined as 12 months without our menstrual period. Often we see that FSH rise above 25. Average onset is typically between 45 and 58, with the average age depending on, the journal or governing body that you look at is usually between ages 49 and 52 is the main average age, because I know 45 to 58 is a very wide range. So estrogen and progesterone levels drop significantly at this time. But again, everyone's different. I've measured estrogen in women in their late 50s and seen it on the higher end. So maybe if you're someone who had estrogen dominance throughout your life, that's something to check in on. If you're someone that might have had PCOS throughout your life, you might also have higher testosterone levels than the average woman, too. So this is where everyone is a little different, and it's nice to measure those levels over time so that you can compare it when we reach this stage. So even if you measure it, perimenopause, menopause, and then postmenopause to see how these changes are impacting your body. We are no longer able to get pregnant once we reach this phase, of course. And like I said earlier, your mother's menopause timing can really hint at yours, unless your mother had a hysterectomy. That makes it a little harder. Um, Key hormones involved in our menstrual cycle in general is estrogen. Estrogen is primarily, like I said, in the estradiol form. Estrogen regulates our menstrual cycle, protects our bones, protects our cognition, our skin elasticity, and of course, the lubrication of our joints and our cardiovascular health, as it does play a role in positively favoring our lipid profile, aka keeping our LDL cholesterol lower, our HDL cholesterol lower. Estrogen causes us to store more of our adipose or fat tissue in our hips and buttocks. So as estrogen deduces, we're more likely to store more abdominally and potentially as visceral fat. So that is what also is linked with the increase in heart health risk once we go through menopause. Progesterone helps to balance estrogen, so it's always a dance, especially in that second half of your cycle, between the ratio of estrogen to progesterone. I like to measure that in menstruating women days about 19 to 21, depending on the length of your cycle, to see that ratio or balance between the two. Do we have estrogen dominance, truly high estrogen? Do we have, low progesterone? And because we have low progesterone, we have what's called secondary estrogen dominance, that the estrogen isn't really high, but in ratio to progesterone, it is. So that could also affect sleep and really mood. Sleep in terms of hot flashes, right? Especially when estrogen is going up and down. For those of us who, before we get our period, we notice that we're sweating a lot or have difficulty sleeping. When menstruating, that's a sign of estrogen coming down right before our period. And some of us have what I like to say bigger swings than others, like coming from high to low. How quickly that happens, every cycle is a little different too. And that's why, in a sense, getting our period is such a blessing that it keeps us attuned with our body and what's going on. Hold on, my dog is eating my cat's food and I'm going to freak out. Xena, stop doing that. She always knows when to sneak down there. She's a little sneaky one. She got caught. She's lucky mom's on camera. No, I'm kidding. Okay. So my cat's watching, like, don't you dare. Okay, sorry guys. I digress. FSH, follicular stimulating hormone. So that signals ovaries to mature eggs and it rises over time, like we said. So that's again, like I was stating earlier, a great lab to check in with. Luteinizing hormone is what communicates to our ovaries as well. So that starts to trigger ovulation. So it's a giant communication loop between, I live in a basement apartment, so I'm sorry if you guys hear people overhead, but the luteinizing hormone and stimulating hormone are part of that major communication system between our brain and our ovaries and our uterus. So luteinizing hormone will also rises when ovarian function declines. Sometimes you see that ratio a little altered, especially if someone has PCOS. So sometimes we weren't really measuring our hormones throughout our life until we have go through menopause. And that's where sometimes you find in some individuals that maybe they had some markers of PCOS throughout their life. So it's also an interesting time to maybe discover that as well, especially with regard to testosterone. Testosterone, for the most part, is pretty even keel throughout our cycle, except for when we are ovulating. So we're supposed to see a bump up, and I'll go over that in the next slide, in testosterone. Testosterone supports libido, muscle mass. This is why men have a higher metabolic rate than us. They have more testosterone. More testosterone equals more muscle. More muscle means I need to eat more calories to be able to sustain that muscle, and I'm burning more calories to keep that muscle alive. So, therefore, a higher metabolic rate. So, more testosterone, more muscle. Testosterone can impact mood, confidence, energy, and is produced in the ovaries and adrenal glands. So this is just a awesome diagram of the menstrual cycle. So on the top, you're going to see the follicular development of the egg growing and maturing. If it is not fertilized, it turns into the corpus luteum as it passes through the body. Here in the middle, this is the bigger reason why I wanted to display this slide, is you'll see each of the hormones like FSH in green, estrogen in yellow, progesterone in blue, luteinizing hormone in red. I don't see testosterone on here, but just so you know, testosterone kind of cruises along, pretty even keel, blips up here during ovulation and comes straight through. So it's pretty consistent hormone throughout our cycle. But like you see here during ovulation is when you see that big burst in hormones. And then this is what I was referring to when it comes to measuring progesterone and estrogen in relationship to each other. So, of course, progesterone is supposed to rise higher than estrogen, and then it comes right back down, and then we get our period, start the cycle over again day one, right, of onset of bleeding. Estrogen is the yellow line. So it's also, I call it like a rainbow effect, right? Makes that rainbow just underneath progesterone. So that's what I was referring to earlier, that if someone is not producing a lot of progesterone, maybe they're very stressed and pushing towards cortisol. I'll go into that. and it's coming lower than estrogen, that's where you might find a lot of symptoms that are not as favorable, right? That especially mood changes and sleep disruption, feeling more stressed. So it's all about the ratio of this line to this line, for example. So we typically measure days 19 to about 21 to about that mid peak here between the two at the end of our cycle. The first half of our cycle here is called the follicular cycle. The end of the follicular cycle is when you ovulate, and that second half of that cycle, luteal, think moon, right, setting, is the second half of your cycle, that luteal cycle. The bottom here is indicative of that endometrial lining, that lining on the inside of our uterus. So here is to replicate, the shedding of that uterus, getting our period, and then of course it growing all throughout our cycle until it's time for us to, go through our period again. Lots of fun. Um, Early and premature menopause, that's when it happens earlier, ages 40 to about 45. Premature is typically 40 early or earlier. So there's early and premature. Early is between 40 and 45. Premature is before 40. And premature or early menopause can happen for a few reasons. Cancer treatments like radiation, for example, surgery to remove one's uterus. Often they don't take out the ovaries anymore unless they absolutely have to because they are major endocrine organs. Different genetic conditions can affect this. Of course, your family's genetics, when the women in your family do tend to go through menopause, like I was saying, chronic illness or autoimmune disease, lots of stress on the body, also low BMI, very low BMI can also impact this. Longer postmenopausal window, so meaning the earlier you go through menopause, there's the higher risk for osteoporosis and heart disease because estrogen isn't there protecting for that longer period of time. You can often have more intense symptoms. I remember when my mother was going through menopause, she had had a hysterectomy and her hot flashes were awful. It was almost like a joke in the family. You hot, you cold, roll up, roll down the window, bring the window up. And she had gone through it more rapidly, and more intensely after a hysterectomy. But everyone's different, everyone's body is different too. And it can trigger emotional distress for a multitude of reasons. Hormonally, because there's a physiological change going on in the body, a chemical change that can make us feel emotions a little differently, especially with the rise and fall of estrogen. But also, it marks a change of time in one's lifespan as well. Key hormones involved, like I was saying earlier, we had gone through this. But perimenopause, estrogen has a lot of erratic swings, which that's some I've had some women many women actually come to me and say, Amanda, I'm so upset, I'm feeling anxious, and I can't even put a finger on why. And I know like I'm crying right now, but there's no reason for me to be crying. And I can tell myself there's no reason to be crying, but my body just feels this way, right? Sometimes that's the erratic swings of estrogen are also the deduction in progesterone, which is that feel good relaxation and part related hormone. So the erratic swings in estrogen also correlates a lot with hot flashes. Progesterone, everyone's different in how I've measured women, but sometimes estrogen starts to drop first. Progesterone can start to drop first too, depending on the person. Usually it's progesterone, I find in my practice. So it drops the earliest and most consistently as ovulation becomes irregular. Testosterone tends to find of the big three to drop the latest of estrogen, progesterone, testosterone, where it's more of a gradual, steady decline. But it does start in our 30s, which makes it harder for us to gain muscle as we get older. Doesn't mean it's impossible though. And that's why strength training, healthy diet, sleep, overall balanced lifestyle can really help to blunt this effect. Menopause, of course, once we reach that, we're in that postmenopausal period, those 12 months without a period. You see that sharp fall in estrogen as our estrogen goes from being primarily made from our ovaries to our adrenals. Our adrenals are what we call our estrogen savings bank. So I will get more to this when we touch on stress and how the adrenals really do help to support us in that menopausal time period. Progesterone, very low as we're not ovulating. And like I was saying earlier, testosterone tends to just gradually decline over time. It's not a sharp drop. Okay. Postmenopause, Um, we want to just make sure we note that there is an increased risk for heart disease and osteoporosis. Also, different joint pains. We're going to get into the common complaints that patients come in with. A lot of it's also because estrogen's responsible for that elasticity, right? That collagen production. So I've had a lot of women say to me, "Oh my gosh, I had frozen shoulder, and I thought, maybe I was doing something to it, and I agitate it," which, yeah, of course, like nature versus nurture, but estrogen also helps to protect the joint. And having that drop in estrogen is also linked with different joint discomforts, especially like frozen shoulder, as that bursa is more likely to also get inflamed. So we want to also note to take care of ourselves from an anti-inflammatory standpoint to mitigate these effects. It's super important that if you note vaginal bleeding after you are in menopause, that should be evaluated immediately. There could be different concerns, um, and that is an important sign to be aware of with your body. Signs and symptoms. So menopause affects individuals differently, like we've been saying. Just as everyone's period's different throughout their lifespan, menopause is different for every woman, as all women are, a little different. Um, it is influenced. So part of what influences our transition into menopause is our activity level, our BMI, our ethnicity, geographic location. I disagree with, actually. I'm going to take that off. So please disregard that. History of anxiety or depression can influence this as we get into the utilization of our adrenals to make sex hormones. So what I'll talk more about is called the pregnenolone steal. Pregnenolone is a precursor hormone that is used as a building block to make other hormones. So in your adrenals, which is responsible for making cortisol, and also helping to make other sex hormones. So think fight or flight and then rest and digest, right? Like our parasympathetic versus sympathetic nervous system. So if we're in fight or flight or we're really stressed out, our body wants to make cortisol from that pregnenolone or DHEA. If our body is in a more relaxed state and we're not very stressed, our body is going to use that pregnenolone to make other hormones like progesterone, for example. So, this is where anxiety and depression can play a role with your hormone levels, right? So, this is why stress management is important for lots of reasons, and including heart health, right? So, stress is linked with adverse effects on the heart and like heart disease. Medications, medical history, and smoking status. Hot flashes can be triggered by inflammation, spicy foods, alcohol, caffeine, heat, stress. So, tracking your daily habits in relationship to your symptoms can help you to better manage your triggers effectively if you notice that hot flashes are a major concern of yours, especially going into bed or when you are sleeping and then it's impacting your sleep. But there's lots of reasons why sleep can be disrupted when we're going through these changes, especially if we're stressed out, waking up in the middle of the night, maybe have poor glycemic control or blood sugar control. Vasomotor symptoms, so temperature regulation, common symptom changes of menopause. So, like I was saying, hot flashes, night sweats, skin flushing, irregular heartbeat, that rapid heartbeat, musculoskeletal or joint related symptoms like that joint stiffness. I often see in the shoulders. That's when people will complain about it, but it can affect knees, hips, joints in the hands. So, things are related. Sometimes things aren't just like a coincidence, right? So it's important to pay attention to your body and don't be afraid to tell your doctor how you feel. It's important. Tell your dietitian, let us know, because if you let us know so we can help, that's always the thing. We don't want to keep things under wraps. And the more we talk about it, the more other people might also start to put those pieces together and it might help somebody else too. Generalized muscle aches. linked to lower estrogen, which can also increase inflammation and slower recovery after exercise. So that's why, especially at this time period, we want to be following an anti-inflammatory diet, but this should be something that we want to follow throughout our whole life, right? So we want to try to implement as many habits earlier on, but it's also never too late to implement, especially with smoking cessation as well. If someone is smoking, it is still always best to quit, even if someone's been smoking since they were, a teen. The just quitting in general can make a large impact on the lungs and, of course, heart health related to smoking. Increased risk of osteoporosis. So estrogen protects our body mass in terms of our bones. So we do see a thinning of the bones, reduced bone density. I think it's good to try to get a DEXA scan earlier on, so then you can measure that over time and see how your bones are changing. Get like a good baseline, like I was saying about your hormones. Get a baseline of your hormones, so then subsequently you can measure every, couple of years depending on those results, just to track your body, track what's happening. Vaginal dryness is often a very common complaint individuals will come in with due to that reduced estrogen, leading to decreased natural lubrication and elasticity. That's across the body, not just in the skin, in the vaginal wall. Pain during sex, especially due to friction or irritation or dryness, because that skin is a little bit drier, lacking in elasticity. Recurrent UTI infections, especially if there are cuts down there, say that can get infected too. Um, and especially if someone has higher blood sugars and that sugar is in the urine. And of course, bacteria love sugar. So that can all lead to a culmination of issues down there. Decreased libido or arousal changes due to these hormonal shifts, right? If testosterone's decreasing, testosterone's a big driver of that libido. Sometimes that can affect it, or just, feeling uncomfortable due to that deduced estrogen. So, life is short. We should be feeling better. So if you are feeling these symptoms, again, I know it might feel uncomfortable, but it's important to talk about so that, we can go on with our lives and be happy and enjoy life. Bladder control difficulties, of course, increased frequency, urgency, or mild leakage. Sometimes that's also due to muscle atrophy or reduced strength in the pelvic floor. I think most of us can benefit from pelvic floor therapy, or just in general working our pelvic floor. A lot of that is core work, focusing on those muscles in the lower abdomen, of course. Work, even a personal trainer may even help with that, but often see if your insurance can cover pelvic floor therapy, or trying to talk with your OBGYN about getting a referral. Many people can benefit, especially if you have individuals in your family who may be pregnant or after giving birth. It can and make a difference lifelong. Psychological and general symptoms, like we were saying, mood swings, anxiety, depression, due to the culmination of changes that go on with estrogen, progesterone, and testosterone, insomnia and sleep disturbances, which there's a trickle down, right? Sleep is when everything's supposed to be resting and honestly regenerating, right? So when you sleep is when your muscles are growing. So if you're not sleeping well, your muscles aren't getting that time to grow and restore. Same with your gut lining, that's not getting that time to grow and restore. So focusing in on sleep is definitely a highlight of mine, I feel, when it comes to treating those going through these changes. Fatigue, right? Headaches, migraines, especially when it comes to those swings in estrogen. I know I get that if I'm going through a hard cycle where my estrogen kind of just hits a big drop. I'm more prone for migraines and nausea, and sometimes that has to do with prostaglandin release and different cytokines or inflammatory molecules that can also give us those symptoms. So like I was saying, everything's correlated. So if you're noticing these symptoms, it's important to jot them down, see if it's in relation to other things, work with a healthcare provider so that we can help to put those pieces together and then come up with solutions so that you don't have to deal with that, right? Like a lot of our life, we've been told, oh, that's normal, that's just being a woman. Yeah, but like we don't have to suffer, right? So we don't need to suffer in silence, and there are things that we can do. Like I was saying earlier, weight gain around the abdomen due to that shift in estrogen is more common. I have a lot of individuals who come in and say, "Man, I've never had, my waist circumference like this. I'm gaining so much visceral fat. I really want to target the visceral fat," and that's what we do often in nutrition counseling, in conjunction with managing other markers of health, like especially our lipids, right? So heart disease is the greatest killer of women. And I think it's extremely important not to overlook that, to measure your cholesterol, take it seriously, measure your blood pressure, manage your stress. We want to really, be aware of our heart. We want to check in with the cardiologist and our primary care physician, see if a calcium score is recommended. A calcium score is a wonderful test that tells you about the calcification in your arteries. Um, as atherosclerosis, that hardening, that plaque buildup in the arteries can lead to, stroke or blockages or a heart attack. So the more you know, right? The more you know, the better odds we are at fixing things, right? Cancer, chronic lower respiratory diseases, stroke, Alzheimer's disease, unintentional injuries, think like a hip, right? Breaking a hip. So this is why bone health and getting that DEXA scan and focusing on building up our bones is so important, as those who fall and break a hip are 50% likely to pass away within a year after breaking that hip. It also leads to a big change in one's, how would I say, how do I want to phrase this? One's ability to live freely, right? Mobility. So we want to definitely take our bone health very seriously. Diabetes is the second leading cause. And of course, then, cold and flu, influenza, pneumonia, kidney disease, and septicemia, right? Infection. So these are the leading threats to women's health. But what's really wonderful is with most of these, uh, we can manage these with contributing lifestyle factors like staying on top of our screenings, our mammograms. We can consider thermography, which helps to look at the flow throughout our body, stress management, sleep, nutrition, physical activity, and our daily environment, meaning, of course, different pollutants or, what we may be taking in terms of our perfumes and our beauty products, our cleaning products, etc. So we went a lot into this, so I don't want to be overtly redundant of the roles of estrogen. And it's just good to note that primarily the perimenopausal transition can usually occur over the course of 3 to 10 years. So many women may be going through perimenopause, the earlier phases in their mid 40s, and not even note it. So I think it's cool to be aware of that and to check in on oneself. We did go over, of course, how, the change in estrogen does impact our body. So I don't want to be redundant here. I just like the layout of that slide. Weight management. Many women say, I have this unexplained weight gain. I don't know where it's coming from. So this helps us to put a thumb on it, right? It's the change in estrogen often, right? So we could see that what is visceral fat versus subcutaneous fat, right? Visceral fat's that like harder fat where it's deep to the organs. So you could see that here in this image. And because it's deep to those organs, fat or adipose tissue, I like saying adipose tissue better than saying fat tissue, was originally thought to not be what's called metabolically active. But that's more so subcutaneous fat, that fat that's just below the skin, right? Just below, that's, grabbable like on our skin. The visceral fat, however, is metabolically active. So it does release what's called cytokines. These are inflammatory molecules that can lead to what's called free radical damage. And those molecules get released very close in proximity to the organs and can cause damage to the tissues of those organs. Also, think of it, it's kind of like how you explain it. It's encapsulating it. It's reducing the organ's ability. How should I say, the freedom of those organs to be oxygenated, that free blood flow. So visceral fat is important to measure. At the practice, we do have the blessing of having what's called an in-body scale. Back when I worked for the state and federal government, we would do research under the CDC and NIH, and the InBody scale is considered valid enough to use in these large studies to measure visceral fat. So, of course, you can come in. That's measured, of course, free of charge with your nutrition counseling appointment. And you can track that over time and see your risk. Using an in-body scale, we want our visceral fat to be under a 10. The lower, the better. However, just note that like college kids in their prime are typically around a 4. So getting a 0 visceral fat, I've never seen, and nor would I think that's always healthy. But we do want to keep it under a 10. The higher our visceral fat is, the greater the risk for different comorbidities or what you call chronic metabolic diseases or inflammatory diseases like cardiovascular disease, diabetes, and cancer, the big three. Declining metabolism has been linked with menopause due to the change in our testosterone. That's why it's important to keep our muscle mass up, strength train, eat a high protein diet, which we're going to get more into now. On now, what can I do? Right, I've learned all this stuff. Now, what can I do to fix it? What can I do to, take charge of my health and keep myself happy, healthy? And I want to be a centenarian, right? So that's what this second half of the presentation is about. So more positive, right? So, of course, like I like to say, the Mediterranean diet, keep it simple, right? That's the key for most chronic metabolic diseases. With the Mediterranean diet, this is the pyramid that you'll see. So the true base is actually movement, having purpose, family meal table. Family is who what you make it. Doesn't have to be biological family, but having loved ones. Then of course, water is your base beverage, liquid, your base macronutrient technically. Tea is a part of a healthy diet, especially a mind diet, to help to counteract the effects of the deduction in estrogen. Tea has many nutrients to protect the brain, including green tea especially. So the mind diet is essentially the Mediterranean diet with an emphasis on tea and berries. So that's why I like to mention that. You could see here the first food tier at the bottom. You're noticing a lot of common foods, like what does the whole grain bread and the whole grain pasta have to do with the olive oil, have to do with the fruits and the vegetables. Note they're all plants. They all grow from the ground. They're all minimally processed, and they all contain what you call phytonutrients or antioxidants often, especially your fruits and vegetables and olive oil. So that should be the base of your diet, right? Um, in a perfect world, we want to try to make half of our plate non-starchy vegetables, and we want to try to get 2 to 3 fruits in per day. Note some fruits, the serving size like a banana is equivalent to 2 fruits. 2 kiwis is 1 serving, 2 clementines is 1 serving, but typically an orange, an apple, a pear is a serving. Or if it's, small piece fruit, like I like to say, like cut up fruit, right? Like melon or berries, typically about 3/4 to 1 cup is about a serving size. As you go up though, on the pyramid, you see nuts and seeds and whole olives. Even though there's olive oil should be your primary cooking oil. That's why you see that a little lower on the pyramid. And then, of course, you see different herbs and spices. Although they're tiny, they are mighty, and they contain lots of antioxidants and phytonutrients to help support us. For example, flax seeds contain soy isoflavones. So they're non-soy, but soy isoflavones, if you don't have a risk for estrogen receptor cancers or you don't have high estrogen overall, can help mitigate the effects of the dropping estrogen, those changes throughout our cycle. So those are in flax seeds. As you go up, you do see dairy. So dairy is very dependent on the individual of your tolerance to dairy and your gut health. But essentially, we're getting at when you see glasses of milk, think almond milk, unsweetened coconut milk, unsweetened flax milk, for example, yogurt, coming from, grass-fed cows, right? Or grass-fed, cottage cheese if you could find it. I do really like the brand Nancy's and Stonyfield grass-fed Greek yogurt are great. Cheeses, think, we don't have to eat exactly like they do in Italy, but think this food pattern, right? Or in Greece. So I think hard cheeses, your locatelli, your Parmesan, your Romano, often they're high in magnesium, low in fat, have protein in it. If you're gonna have mozzarella, like a low moisture mozzarella, sharp cheddar, we don't really want the super squishy, um, soft cheeses. If you do, try to go for grass-fed. Uh, as you go up, you see more of the produce that I like to say, not produce, the proteins that I like to say swim or fly. So let's picture turkeys or chickens flying, though, in theory. So, of course, seafood is a predominant source in the Mediterranean diet. A great way to follow an anti-inflammatory diet is to get plenty of omega 3s. Your best sources of omega 3s, the DHA, EPA sources come from sardines, anchovies. The smaller the mouth of the fish, the less likely you are to get heavy metals. So those are your smaller mouth fish. I like to recommend anchovies. Cook it as a paste. First, start with olive oil on the pan, a little garlic, a little white onions, and then, let that cook until fragrant. And then maybe add a little bit of those anchovies from the jar onto the pan to give it flavor. It does give a little salt too, and some omega 3s. You could also include salmon. Salmon does not have as much heavy metals as, say, tuna. Tuna is a much bigger fish. It's alive longer and will a lot if served. I should say it's just a bigger fish circulating the seas. You want to try to aim for wild caught if you can. I also know and understand that groceries are pricey. That if you want to get Atlantic farm raised salmon specifically from Faroe Island or Norway, those are better places to get off-land farm-raised fish. We want to avoid on-land farm-raised fish because they're often fed corn and soy and food's not natural to their diet. They become like a sickly color and they actually get dyed pink, where when they're, in Norway, they're trying to mimic the diet naturally, found with the wild caught fish, where they eat lots of krill. Krill is really high in omega 3s. So it's all about the food chain, right? The fish eat the krill, gives the fish the omega 3s. We eat the fish, we get the omega 3s. So they're swimming in netted pods in the ocean in Norway and off Faroe Island, cold water fish, and fed that krill so that they aren't dyed. They naturally have that omega 3 rich pinky color. Eggs are great. I'm so tired of hearing about eggs being not good. Again, just like the fish, it depends where it comes from, right? And I'm trying to enunciate well here, saying pasture raised. You want to try to aim for pasture raised eggs. The more orangey colored the yolk is, right? The color of our food tells us so much that that deep orangey horizon colored yolk, there's more omega 3s, less saturated fats, but also note that color comes from vitamin A and vitamin E. So you're getting more vitamins and minerals versus that dull yellow Eggland's Best color. I know that they can get pricey. Often what I like to do is have, 1 to 2 whole eggs, and then I like to boost up my protein with a little bit of the liquid egg white. So I'm not wasting the money on, cracking the egg and wasting that yolk. If those liquid egg whites are really not for you and you have dogs, yolks are great for their coat. Just check in with your vet to always, confirm what's best for your animal. As you go up the chain, red meat is not the devil. You could have, depending on your needs, typically about 2 times per week. But just like the eggs and the fish, we are where our food comes from. We are how our food is treated. So if that cow is grass fed, it's able to be pasture raised, which is a step above farm raised. It's a larger area of land for them to roam, eat the grass, eat the bugs, etc. The quality of the meat is better, especially, sorry, my light just went out. Especially if they're not a very stressed animal. The cortisol, believe it or not, that the animals experience does impact the quality and the marbling of the meat. And there's room for everything in a balanced diet. No, of course, it's not the base of the diet, but okay, some sweets from time to time. That's all right. We want to try to aim for homemade options, low sugar options when we do indulge. To support estrogen metabolism, estrogen breaks down into E2, E3, and oh, sorry, E2, E4, and E16 as it passes through the body based on our genetics and our body's inflammation can dictate what form it passes in. So the lower the number, typically the less inflammatory. So E2 is less inflammatory than E16. If you're more prone for your estrogen breaking down into an E16 form, this can be measured with a Dutch test. It's not often measured with your OBGYN. This is a considered an HSA FSA covered test that we do offer at the practice, especially if you are noticing lots of breast tenderness, fibroids in the breasts or in the lower reproductive system, like your uterus, for example, ovaries. It could be good to find this out. Cruciferous vegetables help to push that estrogen into a less inflammatory form from an E16 to an E2 or E4 and help that pass through the liver. Of course, as we're going through these changes and estrogen is deducing, we want to try to have lots of high fiber foods to capture that, like almost like a netting, and pass it through the body in the stool. Just like anything with detoxification, if you caught our last presentation last month, water, 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 water. Try to get in at least 2 to 2.5 liters per day or half your body weight in water. Bitter foods can help your liver to better clear these hormone metabolites or the breakdown product of estrogen, like arugula, dandelion greens, beet greens, turmeric, curcumin, the active form in turmeric, really can help support the liver and inflammation in general, especially if you're getting joint pains. It's important to note, though, when you do take turmeric or you cook with turmeric as a spice, you want to make sure there's black pepper and that you have it with a little fat, right? So cooking some rice, putting a little olive oil in the rice and some turmeric and a little black pepper, bada bing, bada boom, you're gonna help that absorption a little better. DIM, that comes from your cruciferous vegetables. Sometimes we do supplement that in women who do have high estrogen and also more prone towards pushing to that E16, more inflammatory form of estrogen. Calcium D-glucuronidate and omega-3 fatty acids are also key nutrients in helping this change in estrogen. We'll go through more supplements relating to estrogen, like black cohosh, for example, subsequently in the presentation. The balance of blood sugar is really important as well. This can impact a couple of the hormones in our body. To balance blood sugars, we've actually done a presentation on this, so keep your eyes out because we're looking to do it again too. Just general blood sugar health for anybody, but also if you do have prediabetes or diabetes, it's important for anybody, especially those who are trying to mitigate visceral fat gain or gain of body fat. For most women, depending on your activity, right, you want to aim for about 25 to 35 grams of protein per meal. So that's looking at like 4 to 6 ounces of protein. Think like chicken, turkey, white fish, salmon, like we were saying earlier. You want to include healthy fats. Cook with olive oil, especially if it's at a lower heat. If you have the burner on high, if you are grilling at a high heat or you're using the oven greater than about 375, really try to do avocado oil or grass-fed butter. Yes, grass-fed butter is also a little better quality than regular butter, similar to like we were talking about with the pasture-raised eggs or the grass-fed cow. There's more nutrients in it. I like the Kerrygold brand. Other healthy fats, though, to include in your body is avocados, nuts, and seeds. So when these foods, like fats and proteins, they're more complex nutrients. So when the acid in your stomach has to break them down, it takes more time for that acid to like really sit and work on those foods. So picture taking like a chicken breast, putting that in OJ, right, in a Tupperware, and then taking another Tupperware, putting, say, avocado in that OJ. Sounds like a gross mixture. I wouldn't eat it though. And then in another Tupperware, putting like whole grain bread. Of course, the whole grain bread, although there's fiber, is going to get broken down a lot faster than the protein or fat. So when you chew up all these foods together in a meal and have a balanced meal with protein, healthy fat, complex carbs, meaning carbs that contain fiber like fruits, vegetables, beans, whole grains, that acid's going to take longer to break it down and it's going to move much more slowly from your stomach into the small intestine. And the small intestine is where that sugar starts to absorb, right? So when it's moving slowly, you're going to see a smaller spike. But say I just ate a bunch of white bread, and was like emotional or whatnot, and I'm not full because there's nothing really binding it together, that acid's gonna like rip right through that and it's going to pass into my small intestine and just dump sugar into my bloodstream. I'm going to see a big spike. I might be more prone for a hot flash, for example, too. Inflammation is correlated with elevated blood sugars. We also measure inflammation too in your blood work. Often that's covered by insurance. So we'll use a lab called C-reactive protein, which can tell you the practitioner and the patient about total body inflammation. And that can help to drive care and further testing based on those results. You want to, like I said, avoid having carbs by themselves. Every carb needs a friend, right? So we just pair them. Apple with apple with nuts, right? Or Chomp's turkey jerky stick with a pear. Or we do some hummus with some vegetables, for example. Those are all examples of paired snacks. And we really want to avoid added sugars and refined carbs. If you do indulge, try to aim for homemade. And for the love of God, sweetened drinks, think about it. There's nothing slowing that down. That's a liquid that's just going to dump right into your bloodstream. Some of it will even get absorbed in the mouth. So that's one of the worst things we could do for our body is drink things like soda. Even diet has been linked with metabolic concerns for the liver, cancer, and early onset cognitive decline. So although, do you want to take the sugar? Do you want to take the chemicals? Both isn't really the greatest. And I always see sweetened beverages like soda as just such a waste of calories in the way of we're not getting any nutrients from it. And I don't want to see anything in life this way, but because of course food is also about enjoyment. But when you look at the food, it's kind of like, what are you going to do for me? Is there nutrients in there? Is there something that my body's going to absorb and take and build and turn something positive from those nutrients? Or am I going to take it in and it's going to, cause detriment to my body? Where the sweetened drinks, you might get some hydration, but really it's more negative than good. Um, why balancing our blood sugar makes a difference? Estrogen declines, increases insulin resistance, so making blood sugar spikes worse. Hot flashes, fatigue, midsection weight gain, and mood swings more likely to be prominent. So what we do in our day-to-day life really does add up. Bone support, checking on your bone health, getting a DEXA scan can really give you the gold standard in knowing how much calcium you have. The calcium in your blood does not tell you about your total body calcium. Your bones tell you about your total body calcium and looking at your diet. Leafy greens can give you calcium. Sardines will fish with the bones in it. Of course, dairy-rich foods, some nuts and seeds. I really love the Gerald Steiner water. It is a German mineral water that contains 20% of your daily calcium, which is amazing, and it's hydrating. Vitamin D is extremely important for our bones, also impacts our mood and our thyroid. Get that tested. I think it's good to get tested twice a year, in the summer and in the winter, right? When you're getting sun and when you're not getting sun. When you take vitamin D, it's really great to take vitamin D with K2 because it helps to move that vitamin D into your bones, as well as helps support calcium. Magnesium is essential for bone, as well as boron and lithium. So, magnesium, the highest natural source of magnesium is in pepitas, those little green pumpkin seeds. Chia seeds is a close second, and so is leafy greens. Many of us do not take in enough magnesium. It's one of those supplements that have become very popular. I often like it bundled together as, a reacted form of magnesium glycinate, magnesium citrate, and magnesium threonate together. Again, working with a registered dietitian will help to customize your supplement regimen. But just note, it's a pyramid, right? The base is your diet. The supplements are like a small thing at the top. What's going to make the biggest impact is what you're eating on a day to day, how you're moving your body, your mental status, and your environment. Then, look at supplements as a way of supplementing your food of what you're not able to take in your food. The pills should not take over for your diet. Um, we really want to try to get from food because there's other nutrients that come from it. It's more cost effective, and you're also more likely to absorb it better when it comes from food. And then, of course, protein. Protein is essential for every cell in the body, preserving muscle mass and our metabolism. So you want to aim for, on average, on the absolute lowest end. This is the absolute lowest end, 1 to 1.2 grams of protein per kilogram body weight per day. So you take your weight and divide that by 2.2 to get kilograms, and you multiply that by 1.2. That is, to me, that's the lowest, I feel. Typically about 25 to 35 grams of protein per meal. Different medical statuses, and especially if you strength train, is going to change that. We want to try to aim to strength train 2 to 4 times per week. Consider working with a personal trainer for a month. You'll learn so much about your body. You'll learn better ways to navigate the gym, building a program, because I see a lot of people that are training, but not necessarily training the most effective way for their time and the safest way for their joints. We say compound lifts are functional exercises to try to get the most work done in the shortest amount of time so that you can make the most of your time in the gym. Creatine has become a very hot nutrient. It's actually one of the only supplements when I played lacrosse in college that the NCAA would let us take. Creatine is a very safe supplement. So long as you don't have issues with kidneys and hydration, you will see that in someone's labs. So, creatine on the low end is about 3 to 5 grams. There's even talks to raise it to 10 grams, especially for cognition in women postmenopausal. So, creatine, I like to say, take it at least consistently first, right? Make sure you're consistent before you start taking it. Make sure you're hydrating, right? Like, I won't recommend someone take creatine unless they're getting enough water. Because if you're not getting enough water, then what's the point of creatine? Um, and then I do like to recommend it in the powdered creatine monohydrate form versus the gummies, because then there's less gums and sugars, but also you need the water, right? So put the powder in the water and you get another glass of water, and it's a huge win. Um, Again, the monohydrate form is one of the more superior forms. I like the brand Clean Athlete, but there's so many great brands. Bulk Supplements is also a great brand too, and that's highly tested by consumer labs and always top ranked and price efficient too. Prioritize leucine rich foods, so animal rich foods typically. Leucine is an amino acid that helps to spur what's called mTOR signaling, the growth of muscle. So you're going to get a lot more leucine if you eat, eggs, poultry, fish, red meat, versus you do have leucine in certain plant foods, but you have to eat a lot more of them to get it. So part of the recommendation of why it's so good to try to get 25 to 35 grams of protein per meal is that you're getting enough leucine to activate what's called mTOR signaling to then help spur and build muscle growth. Of course, daily movement, there's working out, right? Like exercising, strength training, like I said, 2 to 4 times per week. But also, did I work out in the morning and then sit and do work all day and not move my body? So you want to also not just think about how often you are working out, but your daily movement throughout the day, trying to break up your steps. If steps are difficult to get, like for me, sometimes it's really hard with my schedule and how I'm booked to just go out and take a walk. So if I can get, 10 to 20 squats in between patients, that can also help to make a dent, not necessarily my steps, but my blood flow, the activation of my muscles to keep me burning throughout the day, and keep me metabolically flexible, burning sugars. We want to support recovery, right? Getting electrolytes, magnesium, omega-3s, especially for sore muscles. Electrolytes are really important for neurological signaling between our muscles. And collagen has become a very hot nutrients, especially with the conversation of menopause, due to that change in elasticity in our skin and our tissues from the reduction in estrogen. Collagen, we like the Vital brand, Further Food brands, Ancient Nutrition brands. They're great. You could put it in your coffee. It does not replace breakfast if we're having protein in our coffee. So please try to take at least a couple bites of your breakfast about 1 to 2 hours after waking with your coffee. I know that's kind of tough to hear for some. It's great to have that collagen with food too, because say you're having fruit at breakfast, likely you're probably getting some kind of vitamin C there, depending on the fruit, especially berries, which will help that collagen absorb and be utilized properly, and also zinc, right? So if you're having some kind of protein, we'll typically have some zinc in it, or you take your multivitamin with breakfast that has zinc. Weight management, these are just some general tips. So you want to try to aim for, look at how much you're often taking in. Like vegetables were not a big part of my life growing up, so my relationship with vegetables had to be a steady climb. So when I used to hear have 2 to 3 cups of vegetables in a meal, I was very like overwhelmed by that. So it's like maybe start with having a half a cup on your plate, then get to 1 cup, and then try to build it up. Can you have a side salad before the meal and then have or a vegetable minestrone now that it's getting colder with some bone broth before the meal, and then have, some vegetables on the plate as well to make a dent there. You'll get your fiber up, and especially those cruciferous vegetables like broccoli, kale, cauliflower, Brussels sprouts, just to name a few, to help with those estrogen metabolites. You want to aim for lean proteins for the most part. Choose as a It is true that there is a metabolic slowdown. So if we're eating tons and tons of like red meat and fatty fish, like again, I'm not going to demonize those foods. There's a place for all foods in the diet. But if I'm having that every day, it's just a lot of extra calories too. So we want to be particular how often we're having fatty fish, say 3 times a week, no more, and red meat no more than 2 times a week. But really try to lean on white fish, chicken, turkey, for example, egg whites, shrimp. Those can be great lean proteins. Choose complex starches, like we were saying, fruits, vegetables, whole grains. Beans are unsung heroes for fiber. 1 cup of beans have 10 to 15 grams of fiber in it. If you're like, beans don't make me feel good, it's a lot of fiber. So if you're not used to having that amount of fiber, start with small portions. Let those muscles in the colon build up their strength to be able to propel those beans through the body, that fiber through the body. Have lots of water and build up your tolerance gradually. If it's the lectins in the beans that bother you, try the brand Jovial. It's pre-fermented. Pre-fermented beans can be a little easier to tolerate if the lectins are something that is hard for your body to process. Pre and probiotics can also help your body clear estrogen as it moves through your body. I really like the SFI Complete and Megaspore. It's a pink and white bottle. Culturelle and Align are very commonly recommended and on many shelves. Those are probiotics, aka live strains of bacteria. Prebiotics, think more like your fruits and vegetables, for example, especially like your onions, plantains, bananas. Those are great prebiotics, leafy greens, as their food for that bacteria. So often I like to recommend a side salad with a meal using a little olive oil and apple cider vinegar, maybe some fresh herbs or lemon in that as a dressing, because that apple cider vinegar is a natural probiotic. And then also the salad will have some prebiotics in it. Research shows that ground flax seeds, because of the soy isoflavones in it, note flax seeds isn't soy, but it contains phytonutrients called soy isoflavones. So having more flax seeds in your diet can help to reduce night sweats. Um, so I like to recommend, maybe a tablespoon as your healthy fat in, Greek yogurt or cottage cheese in the morning, or pop it in a smoothie as an easy way to take that in. Meal timing is important. Try to focus on having breakfast 1 to 2 hours upon waking. For women who are not yet menopausal, try to eat every 3 to 4 hours. Intermittent fasting is not really your friend until post-menopause, but think of intermittent fasting in terms of the reverse. cutting off eating 2 to 4 hours before bed. You're mitigating a blood sugar spike, you're mitigating the risk for hot flashes, and you might sleep a little bit more soundly because your body isn't working so hard to digest. It'll drop that resting heart rate before you go to bed. And the lower you could drop that resting heart rate, within reason, right, that we're alive, the lower you could drop that resting heart rate to relax before bed. No cold showers before bed, right? That's a morning thing. The likelihood that you're going to have a deeper sleep and have REM sleep, the more likely that that's going to happen. So trying to relax before bed is so important. Cut back where you can portion wise. I go back and forth in it, having that in there. Just be aware of how much you're taking in. I see so many people that just don't eat enough, or especially they don't eat breakfast or they nibble a little at lunch and then they're so hungry at the end of the day, especially when they get home from work and they're like, please give me food. And they're taking in the bulk of their calories when they're the least active versus earlier in the day when they're the most active. Um, if you are a night eater, try to stay within a 12-hour eating window. I feel like that is always a great rule of thumb. Processed foods, right? We want to eat from the earth. We want to eat foods that we can picture growing or roaming on the land. Feedlot red meat, we want to try to avoid and try to get grass fed where we can. Butcher box, a good rancher. You can get better deals for that, or buying in bulk with friends from a local farmer, or going to the farmers markets can be rewarding. Refined processed sugars, keep that as low as you can. Um, my computer's a little frozen. And then, being aware if you notice that you might be more of an emotional eater, that's part of what we talk about in counseling. Some people think that's psych, but we talk about food in relation to emotion and habits in nutrition counseling. As long as it relates to food, it is in our scope. So emotional eating is something and cravings we love to talk about with patients, and we respect everyone's vulnerability because many of us have also gone through it ourselves. This I'm not going to go as in depth due to interest of time, and also it's very verbatim on the scale on the slides. Iron is something that women have tend to have issues with having enough when they are menstruating. Post menstruation, our iron needs go from 18 per day to 8 per day, similar to that of a man because we're not losing as much blood. But it's just important to be aware because we do test ferritin and often find it is functionally, emphasis on functionally low. The range is so wide, you want your ferritin above 50. We'll often see that, the range I think is like 20 to like 200 or 250. If you're seeing a ferritin at 20, 25, 30, it's low. And if you're not having enough iron, it can really impact your goals if it's related to body composition. I also put this in here about too high a iron. Many people don't know that that's actually a thing. I learned that I'm a carrier for hemochromatosis, and it's something you should check in on your iron if you have high iron, because it can lead to joint pain, kidney issues, iron fist, pains in the hands. So it is something to be aware of and to watch your iron. If you do have high iron, you just need to typically donate blood, but it depends on how high your iron is and how chronically high it gets. Um, so again, these are the recommendations. You see how it says 50 just because 50 is the average age of onset for menopause, but really your iron needs will change from 18 milligrams per day to 8 milligrams per day once you go through menopause and you are fully postmenopausal. These are some sources of iron. Iron needs vitamin C to be absorbed, and calcium inhibits its absorption. So, for the love of God, I had one patient who wanted to take her iron supplement with milk, and that was just going to be very painful and crampy and also not help the absorption of the iron. So, we were very happy we caught that early. You want to keep calcium sources and iron if you take that iron supplement separately and take that iron in the morning with maybe a sip of OJ or a few pieces of clementine. Calcium, signs of deficiency, right? Osteoporosis, osteopenia, fractures, difficulty with blood clotting. Calcium is an electrolyte, so it does impact our heart rhythm, our blood pressure, delay of growth in adolescence, etc. Right? So tingling in the hands and feet. That tingling or that skin crawling feeling can also be related to changes in estrogen called pruritus, especially if you notice it around a hot flash. So, it's good to just, check in and be aware of other co-adjoining symptoms. dietary sources of calcium are here on the right. Um, and like I mentioned, the Gerald Steiner water is just wonderful to know about, 20% of your daily calcium. For bone building too, think rebounding or bounding exercises. I think jumping on the trampoline is still a little risky for ankle injuries, joint injuries, but weight training can be really good. Jumping rope for building up those bones, jumping exercises like box jumps, jumping lunges, depending on your joints and your abilities, can be good ways to help build up that bone too. Vitamin D is so important. It helps to keep our bones strong in conjunction with calcium. It helps our nerves carry messages. It helps our build thyroid hormones, build up our immune system, and helps our muscles contract. Especially this time of year, if you notice you tend to get seasonal affective disorder, it's really important to check in on your vitamin D, especially if you're getting sick a lot. You'll see the serum goal here in pink. So often your labs will say on the results, sometimes it's 30 to 100 and sometimes it says 50 to 100. The ideal range for your serum or your blood, vitamin D is 60 to 90. There's a lot of literature backing this up from when, COVID was going on. Vitamin D was a hot topic. The RDA is still only 600 IU. There was talks to change that to make it 2000. I don't know why it's not. Most people I find need at minimum 2000, typically 5000 IU vitamin D, but you don't want to just take it willy-nilly because it is a fat soluble vitamin. So if you have too much of a fat soluble vitamin, it can lead to toxicity and can store in the fat. Where water soluble vitamins, you're more likely just to urinate out. Your fat soluble vitamins are vitamins A, D, E, and K. So K, you're not really likely to go too high on. Vitamin D, it's just worth to check it. It doesn't hurt. There are foods you could see here that contain vitamin D, but off you get the most from sun, especially in the summer. Right now the sun isn't really hitting New York at the greatest angle. So, due to our latitude and longitude, we're just at a higher risk for deficiency. If you have a higher BMI, if you have more melanin, certain genetic predispositions can put us at risk for vitamin D deficiency. Most people are at risk for vitamin D deficiency. So, like I said, try to test it twice a year, the depth of winter and the peak of summer. Omega 3s, if you don't like fatty fish, supplement it. That's it. Like you can get it from flax and chia seeds and walnuts and all these great foods, Brussels sprouts, but you have to eat pounds and pounds of it to get enough. So you're going to exceed your calories before you take in enough. The three main forms is ALA, EPA, and DHA, omega 3s. ALA, for most people, you have to eat pounds and pounds of that form, that plant-based form, to really get enough. Your brain is made out of omega 3s, and your brain runs off sugar. So, or glucose, I should say, right? Unless you're doing keto. That's a whole other conversation. But you want those omega 3s to offset the balance of different inflammatory foods or substances in the bodies, like in the body, like omega 6s. So if you really cannot eat fatty fish, I get it. That's fine. Everybody has, a different palate. Try to take it at least 1 gram per day. Check in with your doctor. You can actually test this. I like Kirkland and I really like Nordic Naturals brands of omega 3s. They are highly ranked and they are tested to make sure that they are not, rancid. You want to store that along with your vitamin D in the fridge because they are fats. Take them together. Especially, sometimes there's some weeks I just don't get the fatty fish in, so I'll take the omega 3. It doesn't have to be so consecutive. You could, think about it in conjunction with what you're eating. But again, just like other fats help fat soluble vitamins get absorbed. So if you're taking vitamin D, you're taking omega 3, try to eat it with a meal containing fat, maybe that you cooked with olive oil or that you have avocado or nuts or seeds or peanut butter with it to help that absorption. Getting extra from plants though doesn't hurt. So I highly recommend having the chia seeds and the flax seeds, for example. And like I said, omega 3s help to offset the balance of omega 6s. So omega 6s are like they're unhealthy fats like soybean oil, vegetable oil, cottonseed oil, corn oil, etc. that could be in lots of processed foods. you will find that you're more prone for inflammation if those omega 6s outweigh your omega 3s. When those omega when fat is absorbed in your body, fat makes the cell wall of your cell. So when you're taking in omega 3s, it's wonderful, right? Omega 3s can make that cell wall. Think of omega 3s like fatty fish, that oily fat, right? That's like slides, right? Versus having a cell made up of fat that's like solid at room temperature. It's sticky. So when you have more omega 3s, it's called cellular adhesion. Those cells, like in your bloodstream, they will actually have in the research like pictures of slides of clusters of blood cells. They're more likely to be like sticking together. And think of risk for like a clot, say, when you're having more omega 6s, because those cell walls are more, sticky and hardened, versus when you're having more omega 3s, those cell walls are more of like that slimy, oily, fish oily kind of texture. So there's less adhesion. They're more likely to slide off of each other. So that's one of the reasons why omega 3 is good for heart health, aside from reducing inflammation. Phytoestrogens, I was mentioning earlier, soybeans, soy a couple times a week if you're getting it from organic sources, non-GMO sources, can be great. It's just hard to do that in this country. It is linked with lower harmful symptoms of menopause, like hot flashes. So those in Australia and like Japan and China tend to take in more of these products, and they tend to not have as how do you explain? They tend not to have as many adverse symptoms when going through menopause, and it's thought to be linked to that, and also high tea intake, anti-inflammatory diet, depending. So lignans, right, like bran, flax seeds, beans also contain phytoestrogen, so it doesn't have to be directly soy. Beans, sprouts can also be phytoestrogens. So I think it's keep it simple. Have the ground flaxseed, keep it in a glass jar in your fridge, add it to breakfast, like a yogurt parfait, cottage cheese parfait, smoothie, etc. Bake with it, right? Put it in the dough. Protein is in every single cell in the body. You need to make sure you're getting enough protein throughout your day. Your body is constantly building protein and breaking down protein, sometimes at different times, right? Breaking down protein, say from your muscle, if you're not getting enough in your food to help build up immune cells. So it's really important to get enough protein in your day. At least try to break 100 grams per day for the average woman, at least. Um, and it's made up of 20 amino acids. 8 out of the 20 cannot be produced in the body and are called essential. So that's why if you're vegan, vegetarian, it's good to have complement proteins where you take, peas and rice or beans and rice to make a complete protein. Animal proteins are considered complete proteins. They are essential for making digestive enzymes. So often I find individuals that are coming in for gut health issues, check in. Are they getting enough protein? Are they getting enough water? Are they getting enough fiber? Because that protein helps to make different digestive enzymes as well. Antibodies that support immune function. Like I said, protein makes every cell in the body. It supports the regulation and expression of DNA and RNA. So sometimes when there is DNA damage, that's when you see, risk for cancer, right? Move essential molecules around the body, right? So proteins are part of our blood chemistry, right? Our cells, hormones, building block of hormones, provide support to the body, our muscle, our bones, very important. So it is not hype. What does a minimum of 20 grams of protein look like? One egg white is about 5 grams of protein. So 4 or 5 egg whites, 3 whole eggs, 3 ounces of turkey. So whenever you see 3 ounces of protein, that's typically about 20, 21 grams of protein. 5 ounces of white fish, 6.5 ounces of Greek yogurt. The Greek yogurts are changing though. So you'll start to see like the Dannon, what is it, Oikos 000, that now they have like 20-gram ones. So some of them are 12 grams of protein, some are 15, some are 20. So it's really good to read the label of the yogurt you're buying. I love to recommend adding the Barney's almond powder. It's like a PB2, PB Fit, but with almonds. And you could add that into your yogurt. Um, I had a patient the other day point that out, and I'm like, oh, I like the almond version better than the peanut version. So PB2, PB Fit, great, but I do like almonds a little more than peanuts. Salmon, 4 ounces, three-fourths cup of 3/4 cup to 1 cup of beans. I like to recommend beans as like your side. So say you're having chicken, but then your starch is beans. You're getting protein from the chicken, but then you're also getting a little extra boost of protein from your starch. So it's a win-win solution. Collagen, there's three different types. And of course, you can get that from beef, fish, chicken. I mentioned the brands earlier, the supplements, Further Foods, Vital, and Ancient Nutrition. Add that to your tea, add that to your coffee. But you could typically get that in animals, especially when you're eating off the bone. I'm not a big fan of chicken wings, but you do get ligaments and tendons in there, which do have a lot of collagen. Bone broth can be a good tool as well, because if you are getting enough protein in per se, you're getting enough amino acids as well to help make collagen. So it's trying to get enough protein in, but then if you can get collagen in, that's wonderful. Often we're just not eating, meat off the bone anymore these days. Collagen needs vitamin C to be absorbed. Think your citrus foods, bell peppers. There's more vitamin C in a bell pepper than an orange. Strawberries, berries in general are high in vitamin C. Tomatoes, they'll help the absorption of your vitamins, of your collagen. Zinc and sulfur are also additional cofactors to help make collagen. The highest, not the when I last checked, the highest natural form of zinc is oysters, one of my favorite foods. Love getting it as an appetizer, like a half a dozen oysters. It's also protein, right? It's a good lean protein. Of course, chickpeas are a high natural source of zinc. Think like your beans, think some of your nuts like cashews, beef, chicken. You get it often from animal meats, or like yogurt are good sources. Ways to prevent the breakdown of our collagen: taking in a lot of sugar. Think barnacles on a rope, right? Like that hardening on the rope that helps, that can cause it to break. Smoking, sunburn, overt sun exposure. The sun's not the devil, but it's burning in the sun, right? Can affect that. Pollutant exposure as well. When we're talking about pollutants, we also want to think of endocrine disruptors that impact our hormones. So you see here in the top left corner, our normal hormone receptor in the green, and that kind of, or a normal hormone, I should say, is the green. The yellow is the hormone receptor. So that hormone is to bind to that receptor to unlock the door and allow that cascade response, that hormone to do what its job, and to permeate into tissues. However, there's certain products like perfumes, for example. I find a lot of my hairdressers have issues with high estrogen. I want to hypothesize that it has to do with the different hairsprays and chemicals and dyes that they're subjected through in their work. I saw a lot of these issues also with my female patients that responded down to 9/11 due to the chemicals that they were subjected to. Um, so you see in purple in the middle is an example of a hormone mimetic, like a chemical, right? And that can bind to that receptor and block the receptor, so that when the actual hormone needs to bind to it, oh, someone's already, that key's already in the door, can't get through. So it can block that hormone from being able to work, or can create like a hyperbolized effect as well, like a mimetic. So there's a blocker and then the mimetic. So the mimetic can bind and often have like a hyperbolized estrogen response. Some hypothesize this is why you see PCOS a little more on the rise, but I haven't seen any papers to back that up, really. Not saying they're not out there, though. Endocrine disruptors include BPA. That's a very common one you might have seen in the news. Dioxanes, right? It's a byproduct in herbicide production and paper bleaching, perchlorate. But PFAs is really the big one that prevents, that nonstick, especially on pans. So it's good to look at the type of pans that you're using to cook with. or checking your water, especially with regard to PCBs if you live near the Bethpage plume. Endocrine disruptors to help mitigate those effects. You could see here, as I'm going to share the slides later, different tips, opening your windows, changing your products. Use the Think Dirty app or the Yuka app to scan the products that you have to, check in what's in there, right? Cook with cast iron, stainless steel, or approved cookware. Check the EWG tap water database, put your zip code in there, see what contaminants have been tested in your water, and then you can find different water filters to help remove that. Eat from home whenever possible. Change your fragrances, right? Consider essential oils instead. Replace plastic containers with glass containers and especially avoid heating in plastic. We went a lot into stress, right, and talked about the pregnenolone steal. Stress, of course, activates that fight or flight response and can impact our memory. It has an effect on our adrenal glands as our adrenals now have to make cortisol. And in taking that pregnenolone to make cortisol versus using it to make other sex hormones. So when you're very stressed, that's why it's considered your adrenals are considered like your estrogen savings bank, in that if you're chronically stressed and pedal to the metal throughout your life and you get into menopause, that those adrenals are really what's going to take over and help you to make that estrogen or have that estrogen to carry you through that other chapter in your life when the ovaries start to reduce estrogen production and become more of like a no longer the primary site of estrogen synthesis. Stress also impacts our digestion. So when we're super stressed out and we're in that fight or flight, things are more likely to halt, cause bloating. It's not really free flowing through your digestive tract, right? When you're more relaxed, your body can rest and digest. So to support your adrenals, of course, working with mental health can always be important. Breath work, I know humming sounds funny. Humming helps to stimulate that vagus nerve and helps stimulate that digestion. Checking in on your sleep patterns. Well, when you get a good night's sleep, you can buffer different stressors better. Um, and it's definitely very important for your heart health. Different minerals can help support your adrenals. Like, I don't recommend the Celtic salt anymore. I need to change that because there's been metals found in that. But like the Hanes or the Jacobson salt, iodized salt, based on your thyroid status, doing nettle tea infusion or a mineral or electrolyte mocktail from the brand Trace Minerals or Jigsaw can be good in your water. Avoid overt fasting, especially if you are menstruating. That can be very stressful on our bodies. Men can handle a different level of fasting compared to women. Include high quality carbs every meal. And I'm not saying, white starches. I'm saying fruits, vegetables, beans, legumes, whole grains. You don't want to be no carb. That's also stressful for your body. Make sure you pair at snacks, like we were saying, protein under healthy fat with a carbohydrate. Add cruciferous vegetables throughout your day. And of course, sulfurous vegetables too, like your garlic and your onions. Mustard seed can also help your body convert DHEA to other hormones. Bottom line is prioritizing stress reduction. What is the main stressor that's making us feel that way? And how can we, make it better? This is a great diagram to take a peek at as you go through the slides. Of course, deep breathing can help manage our stress, exercise, body scan meditations, progressive muscle relaxation. I love when you start at the base of your feet and you squeeze your toes really, really firm, release. You squeeze your calves really, really firm, release, work your way up your quads, etc., all the way to your face. It feels like you're relaxing and releasing that stress metaphorically throughout your body, especially when you cannot sleep versus turning towards our phone and that blue light at night. Rhythmic movement. As you can see, I do that a lot when I present by accident. But rhythmic movement also in terms of, Yoga or mindful exercise, rhythmic movement can be walking. Walking is inherently meditative. You don't have to think when you walk. Think of in lacrosse, you call it flow state. You're not thinking, you're just doing, right? It's something that you enjoy doing and that you could just kind of put yourself through. Tai Chi is a great example of that. Yoga. Visualization is a great tool as well when you're in a stressful situation. Um, I use visualization often when I meditate. I'm floating on a floaty in my pool with the sun on my face, right? I try to just stay in that spot. Time in nature. Nature also, when you're around the trees, they release different phytochemicals called phytocides and actually can help build up your immune cells and relax you, but we cannot replace our mental health providers. Um, just as if, a diabetic is going into, diabetic shock or needs support from their endocrinologist for having mental health issues, we want to definitely touch base with our mental health provider. This is a great graphic just to check in on at another time, just on how sleep impacts weight. Essentially, when you're sleep deprived, you're more likely to crave saturated fats, inflammatory saturated fats, I should say, and sugars. There's a greater potential to increase calories by almost 300 calories per day because that hypothalamus gets a little confused. Am I hungry? Am I tired? What do I need to do for energy? Benefits of getting a good night's sleep is to improve memory and cognition, reduce perceived stress and anxiety. If I'm on 6 hours of sleep versus 8 hours of sleep, I can face the same stressor, and me on 8 hours of sleep is going to be way more even keel versus me on 6 hours of sleep. Improve mood, better digestion, helps promote a better gut microbiome and a replenishing of that gut lining, and it helps us support detox, like those eye boogers, right? I like the 8-3-2-1 method. You want to stop drinking caffeine 8 hours before bed, stop eating 3 hours before bed. 2 to 4 hours is really the window I like to say. Stop drinking 2 hours before bed so you're not waking up to urinate. Reduce blue light and light in general 1 hour before bed to the best of our abilities. And zero, hit the snooze button 0 times. 8-3-2-1. Physical activity is one of our best friends for stress relief, socialization, bone building, building muscle, etc. There's lots of great reasons to keep active, reduce inflammation, keep a healthy body composition, you name it. So, if exercise may have been used in the past as like a punishment to oneself or just something that we've never really enjoyed, we want to try to reframe our definition of exercise. Move your body in a way that feels good for you, right? Could it be, yoga? Could it be dancing? Could it be walking? Could it be, in the warmer months, kayaking? Do what works for you, right? Movement is always key, just to at least be doing something and then tailor it from there. Mindful movement, right? Can we try to make it enjoyable, detach ourselves from our phone, our emails, peel back the layers and figure out what our why is. Why do we want to exercise? It's not just, to look a certain way, right? Let's go deeper. I want to be able to get up and down off the floor more easily. I want to be able to walk my daughter down the aisle. Think about the deeper reason why you want to exercise and what your why is, and let that drive you each day to keep going. Don't work out to eat or eat to work out. Consider it as a joyful part of your day that you look forward to, right? I don't have to earn these calories. Take rest days, please. And patience is a virtue. It will feel good, I promise. Over time, it becomes something that you crave. That, like, the days that I feel like the days I don't work out, I don't feel as good. That I'm like, oh, I just really wish I got a workout in. I'd feel better. My muscles will feel better. My mind will feel clearer. So in summary, some just really quick strategies, right? Avoid trigger foods like caffeine, alcohol, spicy foods, sugar in terms of managing hot flashes. Soy isoflavones like the ground flax seeds can really help to manage hot flashes, for example. Like I was saying, they have a lower incidence of hot flashes in China and Japan and even Australia because of this versus other westernized countries. complex carbs before sleep, like in your meal, in your dinner, right? I'm not saying right before bed, but try to have, complex carbs, breakfast, lunch, dinner, right? Like your fruits, your vegetables, your beans, your whole grains paired with protein and or healthy fat. And then try to make sure you get enough protein in throughout your day. Herbs and supplements can be helpful tools. I find about 70% of women do well with black cohosh. The other 30%, I'm going to be honest, are like unfazed by it, but it does help to balance those estrogen spikes, along with K, and Vitex helps to manage the balance between estrogen and progesterone. Stinging nettle root does have a lot of benefits, but it also, in the form of tea, can provide ample amounts of calcium. You really want to let it soak overnight though, so it could really steep and become more potent. But these are some common treatments that we will use in conjunction with diet and lifestyle to support our women going through different hormone changes. Stinging nettle root also affects sex hormone binding globulins effects, so it can also blunt how active sex hormone binding globulin will bind to other hormones and not make it reactive. So it affects how well that is binding and then how well that hormone can now be freed to permeate into tissues and do its job. So there's often a lot of co-benefits with some of these products. But if you're on any medications, you want to check in specifically, ask your dietitian, specifically ask your doctor if there are any interactions. We often look at that though. The way to get started is to quit talking and to begin doing, right? So today we've been talking a lot about this stuff. We want to pick 1 to 2 things that we really want to do and start to implement that over time. Considerations is, what's my why? Why do I want to do this? I want to just feel better. I want to help my longevity. I want to be as mobile as long as possible. So I want to keep my muscle mass up. Whenever you're implementing something new, can I see myself eating or drinking this way the rest of my life? We don't want to start with fad diets. Notice all these tips and things I said are simple strategies, but it's a lot at once. So picking 1 to 2 things can make it manageable. Do it really consistent for 1 to 3 months and then try to add, 1 to 2 new strategies in. So maybe it's I want to take a walk, after work at least 3 days a week, and I'm going to start to add some ground flaxseed in my yogurt in the morning, 2 to 3 days a week. Start small and build up. Create awareness. Be aware of what you're doing. Awareness is the cornerstone of good health. When you're aware and mindful of what you're doing, okay, I'm doing it. I'm walking 1 day a week, or I'm walking 3 days a week. You know where you're at. So then you can say, okay, I'm gonna try to aim for 4, or I notice I do this Mondays, Wednesdays, and Fridays. Let me try to amplify my goal on Saturdays. Be activity minded. Take advantage of small breaks throughout the day to get your movement in. And when it comes to food, fail to prepare, prepare to fail. Think ahead, make ahead. You don't have to meal prep every little meal or snack for the week, but if you can, think ahead at least the night before for the next meal, it'll be fruitful for you the next day. And if you're struggling, build a team, right? You have dietitians here to support you. You have your providers, you have your family members and friends. Build your team. So I know today was long. I'm going to make this into a YouTube video to listen to as a podcast as well for you guys. Um, but does anyone have any questions? I'm going to stop screen share and check in on the chat. No, I don't believe, Renata, that's a good question. You can get too much iron from a cast iron pan, but it's worth it to check your total iron intake. It's unlikely though to get too much from a cast iron pan, not that much leaches in. People use an iron fish as well and put it into their food to get more iron. That's also another fun tip. Good question. But again, I would just check everyone's iron status is different. Anybody have any questions for me? But most importantly, I want to say thank you for tuning in, guys. You're going to get that sent out to you. And you're going to get the slides, you're going to get the recording. So refer to that as you need. And if you got a question, just, shout it out. You could email it to me if it's a more personal question. We could definitely talk offline. But I hope that everyone has a wonderful night and gets a good night's rest as well. Be well, guys.